Hello everyone, I am Dr. Bharat, consultant surgical oncologist at Fortis Cancer Institute, Bangalore. So, on the occasion of World No Tobacco Day, I am going to talk about the ill effects of tobacco usage. Tobacco is obtained by curing the leaves of tobacco plant. So, tobacco products, there are two main types of tobacco products which are used all over the world: the smoke products and the smokeless products. The smoke products include cigarettes, BDs, cigars, and hookahs, and the smokeless products include snuff, tobacco chewing, snus, and the electronic cigarettes. In India, smokeless form of tobacco is more common, especially tobacco chewing, more than cigarettes or BDs. So there are more than 120 million people who use tobacco in India. That constitutes roughly around 12% of the global tobacco consumption. There are more than 1 million deaths every year because of tobacco related illnesses. So there has been a substantial increase in the usage of tobacco in India compared to the Western world, where the tobacco usage has been reducing. Around 30% of the adult males use tobacco in some kind of form in India, and in females it's around 5%. So 24% of children below 16 years are exposed to some kind of tobacco usage, and 16% of them continue to use tobacco. Tobacco contains nicotine, which is an addictive alkaloid which is mainly responsible for the addiction related to tobacco usage. Other than nicotine, there are more than 4,000 chemicals, including hydrocarbons, benzopyrenes, NNN, NNK, carbon monoxide, heavy metals, and other toxic substances. Out of these, at least 81 chemicals are known to cause cancer. So when we talk about the ill effects of tobacco, it's mainly related to the immediate site which it is exposed to. So when we talk about tobacco usage by smoke or tobacco chewing, the first organ which is exposed to is either the oral cavity or the lungs. So they are exposed to the predominant ill effects of tobacco. But other than these organs, tobacco also affects the other organs of the body. To start with, from top to bottom, in terms of the neurological effects of tobacco, there is an increased risk of stroke. When we come to the oral cavity, there is an increased risk of cancers in the oral cavity, the throat or the voice box, and the esophageal cancers. When we talk about respiratory system, tobacco leads to chronic obstructive pulmonary diseases like bronchitis or emphysema, which leads to difficulty in breathing, and it can also increase the risk of lung cancer. When we talk about the cardiovascular system, it increases the risk of heart attack by causing blockage of the small vessels of the heart, and also causes blockage of peripheral blood vessels, which leads to peripheral vascular disease, which can cause gangrene of the limbs and might need removal of your limb. So when we talk about the intestinal system, tobacco usage leads to ulcers in the stomach. It can also increase the risk of cancers in the GI system, especially pancreatic cancer and esophageal cancers. When we talk about the ill effects of tobacco on a reproductive system, it tends to decrease the fertility rates and increases the risk of infertility, and also increases certain genitourinary cancers like cervical cancers and penile cancers. The effect of tobacco on bone is in terms of osteoporosis and increased risk of fractures. And tobacco usage also reduces the immunity in the body, and you are prone to infections. Tobacco also causes a lot of effect on pregnant women and children. So during pregnancy, tobacco usage leads to risk of low birth weight babies, and in children it can lead to sudden infant death syndrome. And children who are exposed to tobacco use by by passive smoking can have risk of lot of physical and mental developmental abnormalities. So when we talk about tobacco related cancers, tobacco usage can cause cancer all over the body. To start with, so it can cause cancers of the oral cavity, the throat, that's the voice box. It can lead to cancers of the food pipe or the esophagus, stomach cancers. When you smoke tobacco, it can lead to lung cancer. Tobacco also leads to cancers of the kidney, the colon and rectum, and the uterine cervix. Tobacco also increases the risk of liver cancer and acute myeloid leukemia. So when we talk about the predominant forms of tobacco which we use, it is either smoke, that is cigarette or BDs, and smokeless, that is tobacco chewing. Both can lead to increased risk of cancer. So when you have a habit of tobacco chewing, it leads to an increased risk of head and neck cancers, that is the oral cavity cancers, the throat cancers, and the esophageal cancers. When we talk about smoke product of tobacco usage, that is cigarettes or BDs, we are talking about risk of lung cancer. In the world, the top cancers which affect are lung cancers and oral cavity cancers, and both are related to tobacco usage. Tobacco usage is the predominant risk factor for causing lung cancer and oral cavity cancers. In India, oral cavity cancers are among the top cancers which affect males. So I already told you about the commonest tobacco related cancers, which are lung cancer and oral cavity cancers, which are related to the type of tobacco usage, that is tobacco chewing or smoking tobacco products. So when we talk about screening for lung cancer, the international guidelines suggest that any person more than 55 years of age with a history of 30 pack year of smoking should undergo a low dose CT scan as screening for lung cancer. There is no specific test for screening for oral cavity cancers. It's more of a physical examination of the oral cavity, which is done by a clinician for screening for oral cavity cancers. Even after you quit smoking, the effects of tobacco can last for 15 to 20 years. So even if you have quit 15 to 20 years before, you still need to get screened for lung cancer or oral cavity cancer or any other tobacco related cancer. So we usually try to screen for the commonest cancers, that is the lung cancer and the oral cavity cancer. So when we talk about prevention of tobacco related cancers, the simplest way of preventing tobacco related cancer is by avoiding tobacco altogether, be it first hand usage or in terms of second hand usage. So a lot of people are exposed to passive smoking. So if you have friends or relatives who smoke around you, then you are equally exposed to the risk of cancer by the passive smoking. So you should avoid such kind of environments to prevent the risk of tobacco related cancers. So what makes it so difficult to quit tobacco? It's mainly because of nicotine, which is responsible for the addiction of tobacco. Nicotine causes a lot of physical and psychological addiction. So the psychological symptoms of addiction could be, you may not be able to think clearly, you might be sweating a lot, you might be under a lot of stress if you don't use tobacco for a few hours or a few days. The physical symptoms of addiction can include headache, constipation, body pain, tremors, sweating. So all these leads to difficulty in quitting tobacco. So if you are addicted to tobacco, then you might need professional help for quitting tobacco. At the same time, you need to have a lot of motivation and determination to quit tobacco. So when you are on the journey to quit tobacco, the first step is that you have to be motivated and determined to quit tobacco. You shouldn't be quitting tobacco for the sake of someone else. Like supposing if your wife or your family members or your children are forcing you to quit tobacco, that is never going to work. You have to be motivated and determined to do it. So when you take those steps, the first step will obviously be motivation. So if you're not able to quit only by this and you are having a lot of addictive effects of tobacco, then probably the second step you could be taking is taking some counseling sessions with your psychologist or a psychiatrist. That is also going to help you. Even with this, if you are not able to quit tobacco, then probably you need some amount of pharmacotherapy, that is some medications to help you in quitting tobacco. The commonly used medications are nicotine replacement therapies, varenicline and bupropion. So the dose and timing of these medication will be adjusted by the doctor. So the combination of these medicines and behavioral therapy, that is in terms of counseling, is going to help you a long way in quitting tobacco. Along with this, a support group is also going to help you in increasing your chances of quitting tobacco usage. So when we talk about smoking, there is a concept of first hand smoking when a smoker or a tobacco chewer is using a tobacco product, that is first hand smoking. Then there is a concept of second hand and third hand smoking. Second hand smoking is when a smoker exhales the tobacco fumes and that is inhaled by another person who is in the vicinity, that is known as second hand smoking. Then there's a concept of third hand smoking, especially when smoking is done in indoor. These some of the chemicals from tobacco usage might deposit on sofa or carpet, and this residual chemicals might, when a person is sitting on the sofa or on the carpet, they might be exposed to these chemicals by touch or again by inhalation. So that is the concept of third hand smoking. Passive smoking is equally, or I would say, bad than first hand smoking. There are some studies which say that passive smoking is more dangerous than active smoking. Passive smoking equally increases the risk of cardiovascular diseases, stroke, and cancers. So on this World No Tobacco Day, I would request everyone to make every day a no tobacco day.